Hello, a very good afternoon. I am Dr. Srujan Dasyam, consultant gastroenterologist, KIMS Kondapur, Hyderabad. Today, July 28, it is observed as World Hepatitis Day, and the theme for today is Hepatitis Can't Wait. It is because, in spite of the ongoing pandemic of COVID, the death or mortality because of viral hepatitis hasn't stopped. So, on average, there has been a mortality or a death of every single person for every 30 seconds in this ongoing pandemic as well. So, in order to know and spread the awareness about the severity of viral hepatitis and its implications on the liver disease and general health per se, the theme for this year, World Hepatitis Day, is Hepatitis Can't Wait. And I'm here to educate you on chronic viral hepatitis and its implications on liver and general health of human being. So coming to viral hepatitis. What is viral hepatitis? Viral hepatitis is inflammation of the liver secondary to hepatotropic viruses. They are hepatitis A, B, C, D, and E. Viral hepatitis is of two types, acute and chronic. Normally, acute hepatitis is caused by hepatitis A and E viruses, which are usually food or contaminated waterborne infections. And they usually have a prodromal phase and as well as icteric phase where patient has jaundice. And it usually is a self-limiting condition, whereas only in severe cases they require hepatosupportive drugs and proper diet management. Whereas coming to chronic viral hepatitis. Chronic viral hepatitis is caused by virus hepatitis B, C, and D. So, what is chronic viral hepatitis? It is chronic inflammation of the liver. By word chronic, it means that the persistence of virus or its nucleic acid, whether it is RNA or DNA, in the hepatocyte or blood, it is for a duration of minimum 6 months. Hence, it is named chronic viral hepatitis. So now let us know about how is it caused. Hepatitis B and C, which are the main causes of chronic viral hepatitis globally. There are about more than 200 million cases worldwide of chronic viral hepatitis. Usually, the mode of infection is through percutaneous route. By percutaneous route, it means a contaminated needle or injection or via transfusion of contaminated blood or blood products or through IV drug abuse, mainly through sharing of contaminated needles. And last is the vertical transmission, that is from maternal to fetus infection. So these are the common modes of transmission of the viral hepatitis infection. So now let us know what are all the symptoms of viral hepatitis. Usually in chronic viral hepatitis, the symptoms are very subtle. However, in hepatitis B and C, the acute infection is just like any other acute viral hepatitis. It is like a flu-like illness, which has mainly prodrome of malaise, fever, or general body pains, which is followed by an icteric phase of jaundice and vomitings. Over a period, it recovers, but when the person enters the chronic stage of viral hepatitis, the symptoms are very subtle. So, hence, we must know that chronic viral hepatitis patient can be literally an asymptomatic individual, or he can present with very subtle symptoms like malaise or general weakness or fatigue or loss of libido. So these are the very subtle symptoms we must know in case of chronic viral hepatitis. So when a person has chronic viral hepatitis, what are all the implications on the liver. So the chronic viral hepatitis, there is a continuous replication of the virus inside the liver cell. So because of the continuous replication, a normal immune system mounts an immune response. So the symptoms or the hepatocyte cell damage is because of the immune response which is mounted by the host. Here it is a human being, liver cell. It mounts an immune response towards the replicating virus. So hence the symptoms are very subtle, and over a period the patient enters into a phase of progressive liver damage. So coming to the what are all the long-term implications of chronic viral hepatitis? So when the patient presents with subtle symptoms, usually the patients are ignorant of this condition, and usually this set of patients, they are recognized or they are diagnosed only through a routine hospital, in-hospital, outpatient or inpatient screening. Whereas patient who has already developed a chronic liver disease or who presents with a decompensated liver disease, they present with features of liver cell injury, which are in the form of jaundice or progressive abdominal distension or any bleeding episodes, etc. So, overall, the patients who are at risk for this chronic viral hepatitis and who are the people who needs to be screened. So here, the high risk population in chronic viral hepatitis, people who especially IV drug abusers who share needles or persons who receive multiple or any contaminated blood transfusions. So here I must emphasize on persons suffering with blood conditions like thalassemia or hemophilia who happens to receive multiple transfusions in their lifetime. So they might unfortunately uh, expose themselves towards the risk of acquiring this viral hepatitis through contaminated blood or blood products. So here I would like to emphasize on the point that the blood transfusion or transfusion of any blood products should be done after a proper screening for these chronic viral hepatitis viruses, which are hepatitis B and C. So, apart from this, tattooing, which is a common practice in many rural as well as urban populations. So, tattooing as well as body piercing, they possess the risk for acquiring this hepatitis virus. So, whoever is contemplating on getting a tattoo or any body piercing, they should always emphasize on the fact that it should be done on a in a center where there is a proper sterilization technique which is followed, as well as they use disposable needles for that. So these are the common routes of infection for chronic viral hepatitis. Now, after finishing the clinical features, we knew who are the high risk population to whom we screen usually. Usually, in a hospital setting, we screen any patient presenting with features of liver disease as well as altered liver enzymes, as in ALT or SGPT or AST or SGOT enzyme elevation, who presents with a deranged liver function test. We screen them for chronic viral hepatitis. So, among the chronic viral hepatitis, we must know that there are two types of viruses. Here are hepatitis B as well as hepatitis C. Hepatitis B is a DNA virus, whereas hepatitis C is an RNA virus. So, among both, hepatitis C, the majority of the infection and its pathophysiology lies within the cytoplasm of the hepatocyte. It doesn't penetrate the nucleus. Whereas coming to hepatitis B virus, it penetrates, and during its cycle, during its life cycle, it it enters the nucleus and attaches itself to the host DNA. Thereby, among both, if we see, among both, hepatitis B is relatively difficult to treat compared to hepatitis C. And then there are few factors in a patient which increase the risk of progression of the disease. When it comes to chronic viral hepatitis, we must advise the patient few things, of which important ones are: the patient should abstain himself or herself from consuming alcohol. Alcohol consumption in a chronic viral hepatitis patient is bad, as in it increases the rate of progression of disease. And if we speak over a long term, the chances of development of cirrhosis or end-stage liver disease, as well as development of liver cancer or hepatocellular carcinoma, the risk is increased with the concomitant intake of alcohol. As well as patient should be advised about maintaining his body habitus, or patient should be uh, following dietary as well as lifestyle measures. So, because obesity, along with chronic viral hepatitis, is also a risk factor for faster progression of disease. Obesity leads to condition called non-alcoholic fatty liver disease or liver steatosis, wherein we see the patient's liver is accumulated with fat progressively, and over a long period, with the progression, once there is a fat accumulation, there is a liver cell reaction, and over the period, it develops fibrosis. In the general term, the liver becomes more stiffer. As in, when the liver becomes stiffer, it loses its function. So, what is the main function of the liver? It is the synthesis of proteins and detoxification. So, gradually the patient develops a decompensated liver disease. So, we must advise, we must impress upon the patient that in a patient with chronic viral hepatitis, patient should abstain from alcohol, and as well as patient should maintain his body and should not be an obese patient. So, as well as there are other factors, high viral load or older age at presentation. These are the other factors which increase the progression of chronic viral hepatitis and leads to faster progression of the disease. Then comes what are the, apart from these factors preventing the which prevents the progression, what are all the extrahepatic manifestations you should know? So, as I said already, chronic viral hepatitis is very subtle in its presentation. Most of the times, in a compensated liver disease patient, the presentation or the diagnosis is only by screening. Like we tend to run few serological tests for hepatitis B or C and we diagnose, and then retrospectively we uh, measure the liver synthetic function in the form of liver function test, and as well as order a simple scan like an ultrasound to know the liver architecture. So apart from this, there are few extra hepatic, as in non-liver manifestations of chronic viral hepatitis in the form of skin conditions like vasculitis, which is commonly called cryoglobulinic vasculitis. So here the patient can have skin rashes, and involvement of end organs like kidney can also be there in this vasculitis. In addition to this, there is other extrahepatic manifestation in the form of autoimmune diseases or development of type 1 diabetes mellitus. So these are the extrahepatic associations of chronic viral hepatitis, especially hepatitis C. So once we know about this chronic viral hepatitis. So how do we manage a patient with chronic viral hepatitis? So once the patient is diagnosed to have chronic viral hepatitis, then we measure the liver synthetic as well as uh, synthetic function, and we in the form of we order a simple blood test called liver function test, which usually show the bilirubin levels, enzyme levels, as well as the synthetic function of the liver in the form of serum albumin levels. And then we also measure the uh, INR value, which is representative of a coagulant system of the human body. And then liver architecture in the form of an ultrasound, and sometimes we might also order an investigation called Fibroscan. So here I would like to stress few points on Fibroscan. Fibroscan is a relatively newer technique of assessing liver fibrosis. So the values of liver fibrosis is usually given in kilopascal units. So it is relatively cheaper and relatively safer method to assess the liver fibrosis. So why do we have to assess liver fibrosis? Because as a part of evaluation, sometimes when we are in a dilemma of starting therapy, especially in a chronic viral hepatitis B infection, we order fibroscan in order to assess if there is any significant liver fibrosis. So then comes how do we, after assessing uh, this patient, how do we usually prognosticate the patient? So chronic viral hepatitis, usually hepatitis B and hepatitis C. So let us split the management or treatment part separately. So starting with hepatitis B management. So hepatitis B management. So when we decide upon the treatments initiation based on HBV hepatitis B virus DNA levels as well as liver function test, when we decide on starting the therapy, usually it is patient is counseled that this the therapy is going to be for few years, because we must understand that hepatitis B virus is going to stay inside the liver cell, and it has formed a strong association with the host cell nucleus. So in spite of treatment, although we have best drugs, we are still unable to act on this virus which has already formed a complex with the host DNA. So we must counsel the patient. The patient is usually counseled in a way that hepatitis B treatment usually takes few years, and sometimes it's going to be an indefinite or lifelong treatment. So why? Because many times we see in hepatitis B, if after after reaching some serological goals in the form of normalization of LFTs or seroconversions in hepatitis B infection, if we inadvertently stop the treatment, there is a high chance of relapse of hepatitis B infection and as well as progression of the liver disease. So sometimes it is a usual phenomenon that patient is put on hepatitis B treatment, patient is recovered serologically, and patient is asked to follow with the gastroenterologist or hepatologist. But patient loses the follow-up, and or maybe by himself or with the suggestion of some other treating physician, if patient stops the hepatitis B treatment. It is common to see such patients presenting over a few months or years, presenting with a decompensated liver disease. So we must understand the nature, or we must understand the nature of the virus. So hepatitis B virus, as I already mentioned, is little difficult to be treated among hepatitis B and C. And so there are also advantages, and there are number of studies which have proven that whenever we give antiviral therapy, the antivirals which we use in hepatitis B infection are called nucleoside or nucleotide analogs. What do? They usually prevent the replication of virus. So these antivirals, they efficiently stop the virus replicating. So what are the advantages with virus stoppage of virus replication? The advantages are we will be able to positively stop the ongoing liver injury. Here we must understand that ongoing liver injury in chronic viral hepatitis, it forms a risk for future liver decompensation. So usually risk of progression. So in a hepatitis B individual with chronic hepatitis B virus infection, because of the ongoing liver injury, over the few years, patient can develop cirrhosis. So, with inadvertent stoppage of hepatitis B antivirals, usual antivirals what we prescribe are tenofovir and entecavir. So, these stoppage in the middle will cause patient to present with decompensated liver disease after few months to years. And also, hepatitis B is a virus which can individually cause hepatocellular carcinoma or liver cancer. So, with usage of treatment or with usage of antivirals, we are not only normalizing the serology, we are not only stopping the virus replication, but we are also positively stopping the disease progression. We are stopping the development of decompensation, and we are reducing the patient's risk of decompensated liver disease, and we are reducing the risk of development of liver cancer. So this is the importance of usage of antivirals in chronic hepatitis B. And whereas coming to chronic hepatitis C, now post 2014, with the advent of wide usage of drugs called directly acting antivirals against this hepatitis C, the response rate, what we measure in chronic hepatitis C is a sustained virological response. So this is an endpoint of the treatment. So numerous studies have shown that the SVR or the virological response with directly acting antivirals, they are more than 95%. That means we are confidently curing the person with chronic hepatitis C, and the success rate is more than 95% with antivirals. So this is the importance of antivirals and usage. I would like to stress upon in this talk that hepatitis C and chronic hepatitis C as comparatively has been well managed with antivirals compared to chronic hepatitis B, and the success rate is really encouraging. It is more than 95%. So the drugs which we use in treatment of chronic viral hepatitis C, the drug which is sofosbuvir, it forms the backbone of the treatment regimens we give. In addition to sofosbuvir, we usually combine the treatment with other drugs like ledipastor, daclipastor, or belpastor, etc. So the duration is also of limited duration. Unlike hepatitis B, what as I suggested before, that it would take a few years or sometimes a lifelong treatment with antivirals. Whereas in chronic viral hepatitis C, with the advent of directly acting antivirals, the duration it is usually between 12 weeks to 24 weeks. So the advantage is it is a finite duration treatment, and the success rate is more than 95%. So these are the benefits of usage of antivirals. So, and the studies over the last decade, the rates of transplant for treating chronic viral hepatitis C related illness has also declined because of efficient usage of directly acting antivirals. So, in addition to a benefit of getting a proper cure, and the chances of relapse is also less compared to viral hepatitis B. So, here I would like to impress upon the importance of antiviral agents and their usage in case of chronic viral hepatitis. So, I would like to once again imply on the fact that usage of antivirals not only treats the virus, not only keeps the liver disease under check, but also reduces the future risk of decompensation, future risk of liver cell failure, and future risk of development of liver cancer. So this is the importance of antivirals, what we usually prescribe in chronic viral hepatitis. So then next comes how do we follow up the patient? So once the patient is treated, once the patient with chronic viral hepatitis B, initial stages, he is usually asked to follow up us at least every 3 months and check his liver function test as well as the viral load in the form of viral DNA levels. Whereas in chronic viral hepatitis, after a finite duration of treatment of usually 12 weeks, if it is a previously treatment naive patient. So after the end of the 12-week course, then we usually wait for another 12 weeks and check the viral load to see whether the viral load has completely gone to an undetectable levels or not. So this is called a sustained virological response. So this is a treatment endpoint in chronic viral hepatitis C. Whereas in chronic viral hepatitis B infection, the treatment endpoint usually is a seroconversion. We check the serology of the patient, we check the disappearance of an antigen called hepatitis BE antigen, and then we wait for at least 1 year to stop the treatment, and that too, in all the patients, it might not be possible to stop even after achieving seroconversion. So, in chronic viral hepatitis, the patient is usually always counseled that the patient might continue these antivirals for a few years, or sometimes, in case, it can be lifelong. And then coming to how do we prevent the chronic viral hepatitis or viral hepatitis per se? When it comes to acute hepatitis, which are foodborne, hand hygiene and food hygiene, water hygiene are the modes of prevention for acute viral hepatitis like hepatitis A and E. Whereas in chronic viral hepatitis, prevention is through screening. So, who are all the people we screen? Any patient requiring an invasive procedure or surgical procedure is usually screened for viral hepatitis. And any patient who is receiving blood transfusion or blood related products, we should thoroughly screen the blood products for underlying hepatitis viruses. And any antenatal mother presenting uh, presenting to the obstetrician should be thoroughly checked for hepatitis virus along with HIV screening. The importance of vertical transmission. Vertical transmission means transmission of infection from an infected mother to baby or newborn. So the risk is obviously there, and the risk is directly proportional to the viral load of the mother. So any mother, antenatal mother, infected with Hepatotropic viruses, hepatitis B or C, has a potential risk of infecting the fetus. So, hence, the obstetrician usually thoroughly screens at presentation. And when it comes to hepatitis B, so usually at 24 to 28 weeks of gestational age, usually we tend to check the viral load, and depending on that, we also advise antivirals in a mother infected with hepatitis B so that the rates of vertical transmission is reduced in case of chronic hepatitis B infected mother to the baby. Why? Because chronic viral hepatitis, usually when a person gets infected with the hepatitis B virus, if the risk of transmission is through a vertical mode, as in a newborn or fetus acquires infection through an infected mother, then the chances of development of chronic viral hepatitis in such a newborn individual is more. So here in chronic viral hepatitis, chances of development of a chronic viral hepatitis or a newborn infection, as in acute infection turning to a chronic viral hepatitis, it is close to 80% to 90%. So that's why the importance of screening an antenatal mother or treating an appropriate hepatitis B virus infected mother is the importance lies in the fact that the chances of developing a chronic infection in a newly infected newborn is more. It's close to 80 to 90%. So we will be efficiently reducing that risk of the newborn developing or acquiring infection from the infected mother by giving antivirals in the last trimester of the pregnancy. So these are the people who usually require a proper screening. And here I would also like to stress upon another subset of population, especially persons with chronic kidney disease or person who is a person of end-stage renal disease and dialysis dependent. We usually come across this set of people, and in this, various studies worldwide, they have shown that this particular set of population, the percentage of population with chronic hepatitis C is between 9 to 30%. So here, because of multiple uh, dialysis sessions, so this is a setting, separate setting in a healthcare setting, which requires special mention that the dialysis or dialysis dependent patients or a kidney disease patient is a particular risk for developing chronic viral hepatitis, especially chronic viral hepatitis C. So, but even though the patient with chronic viral hepatitis C, who is a dialysis dependent patient, because of the advent of this already mentioned drugs, which are directly acting antivirals in chronic viral hepatitis C, we are able to control the infection and we are able to efficiently treat, and the success rates, I mean the cure rates in the form of SVR or sustained virological response is almost at par with the person in any individual with chronic viral hepatitis, that is more than 90%. So these are the special populations which require screening for chronic viral hepatitis. So having said that, we have finished the prevention part also. Now, after what is the treatment, after discussing these treatment options, so what are all the subset of people uh, or what is the role of a liver transplantation? Now, over the last decade, there has been a tremendous increase in the number of transplants per se, liver, especially liver transplants worldwide, globally, and in India as well. India is no exception for liver transplants. So there are, of course, even though patients are put on treatment, there are people or there are patients who require or who should be listed for liver transplantation as well. So, of the important ones are, even though patients with chronic viral hepatitis on treatment, if they develop features of liver cell failure, which are termed as ACLF, which is acute on chronic liver failure, they are to be listed for transplantation. And any patients with viral hepatitis presenting with acute liver failure, they are also candidates for liver transplantation. And also, any patient who has developed liver cancer or hepatocellular carcinoma, which is appropriate for a treatment with liver transplant, they are also candidates for liver transplantation. So this is the importance of liver transplant in a chronic viral hepatitis patient with chronic liver disease. So after briefly discussing the treatment options, the preventive aspects, the clinical features, the modes of acquiring the infections, and who are all the special people uh, who require attention or who require thorough screening for viral hepatitis. So I would like to end my talk on giving few take-home points. First is chronic viral hepatitis as the uh, as the on occasion of this World Hepatitis Day, hepatitis can't wait is the motto for this year. So the importance of continuous disease progression is to be understood in chronic viral hepatitis. The next, the importance of availability of good drugs, nucleoside or nucleotide analogs for viral hepatitis B, whereas directly acting antivirals for hepatitis C. There is a hope for chronic patients with chronic viral hepatitis. We are able to efficiently manage with these uh, wonderful drugs. We are able to efficiently control the virus replication, but uh, here lies the importance of a continuous and thorough follow-up with your gastroenterologist or a hepatologist, because inadvertent stoppage of antiviral treatment, especially in the case of chronic viral hepatitis B, it might result in development of liver cell failure or liver cancer in the future. And then next, the importance of prevention, especially blood persons who are receiving blood or blood products, or persons who are contemplating tattooing or body piercing. They must ensure that the center in which it is being done, whether it follows proper screening protocol, whether the blood bank or the institute is following thorough screening, and whether of the donors, and whether the center for tattooing or piercing, whether they are following safe practices for that. So here lies the importance of preventing the infection. And then next comes the last important message I would like to give is chronic viral hepatitis. It is manageable condition. There is cure in case of viral hepatitis C, and viral hepatitis B presenting with the chronic hepatitis is manageable. Patient can have decent quality of life, and patient can be uh, properly educated, and with patient cooperation, the symptoms can be almost negligible with strict adherence to the treatment as well as diet and other lifestyle measures what we follow. So here I would like to end my talk, and I would like to thank King's Hospitals for this opportunity. Thank you.